these new measures that were outlined by both the Prime Minister and in the House of Commons, Health Secretary Sajid Javid, who joins me now. We have many other matters to discuss, Secretary of State. Thank you for coming on the show. But most importantly, good morning, sir. What do my listeners have to do as of today and the coming days? Good morning.
Thanks, Nick. The reason we've taken these measures is we've said all along with Omicron that we need to have a strategy where we buy time to assess it and to build our protective defences. In recent days, we've learned more about this variant, especially the rate at which it spreads. It's spreading faster than any other previous COVID-19 variant. We think the doubling time is something between 2.5 to 3 days. And so that means at that rate, you could have 1 million infections by the end of the month. And we've always said if there's new data that suggests that the NHS may come under unsustainable pressure, which means that you and I, your listeners, can't get the emergency care that they need when they need it, that we will need to take action and enact Plan B. So that's what we said yesterday. The Plan B includes the working from home guidance, the new rules on face masks, which come in from tomorrow. The working from home, by the way, comes in from Monday, and also the use of NHS COVID passports in certain settings, and that will apply for Wednesday next week.
What about social distancing? Is that likely to be brought in, Secretary of State?
No, we're not looking at that. It is never part of Plan B for a good reason. When we set out Plan B, and remember we set that out months ago, saying that if the situation changes, if the data worsens, we will act. It doesn't include that, and the measures we've got are well thought through measures that we think can have a significant impact on slowing the spread of COVID-19, but in particular this new variant.
Are we able to rule out social distancing, Mr. Javid?
It's not something we're thinking of at all. And actually, one of the reasons to act swiftly and to act now is that we can not have to take any further measures in the later. I think the history of this pandemic is, whether it's in Britain or in other countries, is that if you act quickly, you act swiftly, you can avoid further measures later down the line.
Teaching unions are suggesting masks in schools to be mandatory. Secretary of State?
Look, when it comes to face masks, we set out where we think it should be mandatory. So there was a measure a week ago about shops and public transport. We're extending that to almost all indoor public settings apart from hospitality. For schools, There's already guidance that in communal areas that masks should be worn. But I think when it comes to the classroom, it is different. I mean, I think that with this pandemic, it's really, in some ways, really hurt children in a particular way in terms of the impact of their education. And I think that should be protected in every way that we
Sorry,
can.
I'm confused. So they should wear them when they're in the corridors, but not in the classrooms?
Yeah, the guidance from the Department of Education is that in communal areas that masks should be worn, but in classrooms there's no requirement to wear them.
So when the nativity play takes place, Joseph and the three wise men should be having face coverings?
No, I don't think that's a requirement, because even with the
But that's in a community
mask
area. That will be in the assembly hall or whatever. It won't be in a classroom. All the mums and dads come along. We heard the Prime Minister say yesterday, nativity plays must go on. So we need Mary to wear a mask.
No, in schools, it's just guidance. There's nothing mandated in schools.
OK. On to other matters. You were heckled as you put some of those measures forward last night in the House of Commons, even by some of your MPs. I mean, one of the lines does seem fair, Secretary of State. Why should the good folk of Bromsgrove, or indeed my listeners, follow these requirements and restrictions when some of the senior colleagues in number 10 Downing Street couldn't last year?
Look, I think it would be wrong to try and conflate these two things. They're both important, by the way. I think they're both important. Of course, the measures we set out yesterday for the reasons that we did, and obviously you're referring to the video that we all saw recently, which I also found very upsetting. But I'm pleased the PM has responded the way that he has, which is to ask for an investigation by the Cabinet Secretary to establish the facts. I think what people want to know are the facts, and having the Cabinet Secretary, who's a very serious professional person, look into this is the right response.
But you told me there was no party when we discussed this last week.
And I would still tell you that I have received assurances that there were no rules that were broken in terms of COVID rules at any time.
But there was a party.
Well, as I'm saying, Nick, I've received assurances that there were no rules were broken.
No. Never mind the rules.
That means the party could not take place. If the rules were not broken, then a party could not take place. But I think having this investigation, having the cabinet secretary look into this, is the right response, because this is the individual that can talk to anyone, can get the data and the evidence together and establish the facts, and that's why the Prime Minister has called for it, and I think it's the right response.
But if cheese and wine was handed round in a secret Santa, wouldn't that qualify as a party in your book?
Well, it's the key word there, Nick, was if. We don't. Look, I wasn't even in the government at the time, and so I really couldn't tell you what was happening, what was not happening. I can just tell you about the assurances that I received, but also having this investigation, it has to be the right thing.
You don't feel let down by some of those assurances you've received?
No, I don't. I think that the response to the video, I say I was upset by the video. I think many people were. I think many of your listeners would have been really upset, and I completely understand that. You remember a lot of people, and I think about my own constituents over that time. They couldn't see their loved ones. They couldn't go to funerals. They couldn't visit their loved ones in care homes, and we all had to pull together. We all had to do our bit, and those rules apply to everyone. It doesn't matter who you were, whether you're in government or outside government, they apply to everyone. So it's right there's a proper investigation of this. There have been allegations. We've all seen and heard the allegations, but it's right that it's properly investigated.
Just lastly on this, we will move on. Do you regret that you scoffed that it was the Daily Mirror that broke this story when I aired this with you last week? Do you owe an apology to the Daily Mirror? Because, true or false, it has led to an extraordinary turn of events within number 10 Downing Street. So the Mirror owes an apology, doesn't it?
Well, I think. Look, I think we've got a very good, free, vibrant press, and it's important that they.
But when I put
go
it to you as a Mirror exclusive, you said, "Well, that's the Daily Mirror, isn't it?" I think they deserve an apology now, don't they?
Well, look, I can't say that perhaps everything in that report is accurate, because again, there's got to be an investigation to look at that. But what I will say is, if this is where you're going, whether it's the Daily Mirror or others, I'm really pleased that we've got the kind of press that we have, that without any fear goes wherever it needs to publish whatever it feels it needs to.
So you're grateful to them?
I'm grateful to all our free press for the job that they do.
How virulent is Omicron?
It is something.
We know the rate of. I get the rate of infection, but when we last spoke, you also said, and I'm sure that tests are going on. Can I put it as how much of a killer virus or strain this is? Do we yet know? Because if we still don't know, might we be taking precautions for something while it is serious? It's not necessarily, quotes, a killer strain.
We don't know fully, but we do know more now than we did even a week ago. So what we know is that the rate of hospitalisation in South Africa is soaring. It's doubling every week. What we also know is that whilst some of the reports of it people will describe it as mild, it is worth just remembering in South Africa that they're in the middle of their summer, unlike the winter. We know these viruses like the winter here. They have the average age of the population, I think, is something like 15 years less than here, and also many people in South Africa have some kind of antibodies that they've built up, but through infection, and a lot of those through the beta variant, which didn't take off here, thankfully. But the beta variant is a bit closer to this new variant, so it's hard to sort of take what's happening in South Africa and apply it completely here. And also, what we do know is that even if it's let's even assume for a second that it is less virulent and it has lower severity than the Delta variant. If the case numbers keep growing at the rate that we're seeing, you might get a smaller percentage of people hospitalised, but it's a smaller percentage of a much, much larger number.
I'm going to mangle my pronunciation, so I apologise before I even start. Are you aware of this drug Zevudi or Zevudi, that is a type of
it's a type of monoclonal antibody.
Sotrovimab, if I'm saying. Now, some people are hailing that this could be a breakthrough in the fight. Can you put that in layman's terms, Secretary of State?
Yeah, this is one great thing is that in dealing with this pandemic, we've got a lot of new treatments. And the Zevedi, the drug that you just mentioned, which is made by GSK, it's described as what's called a monoclonal antibody, and it basically gives you antibodies in a way not too dissimilar to how a vaccine might work. But the early evidence is that it could work quite well with this new variant, and we've bought some of it. We actually, in fact, the MHRA, our independent regulator, was the first to approve it anywhere in the world. We've got over 100,000 doses, and that, alongside other drugs we've got, which you call the antivirals that we've purchased, this gives us much better defences than we've had in the past.
Okay, last couple of questions.
But our best defence is our vaccination programme. That hasn't changed. Yeah,
urge all my listeners. Go ahead one more time, Secretary of State, please.
Especially the booster programme. It couldn't be more important. We expanded it yesterday by reducing the dosage gap to 3 months, and so 7 million more people are eligible over the age of 40, and people can book online now. But if you get the call from the NHS, you get a message. Please do step up, roll up your sleeves, and get protected. Please do.
Absolutely. Last couple of things. With the claims that this is going to tank the economy, these new measures, were the Cabinet as one with the decision to bring in Plan B?
Yes, it was a very
dissent.
Straightforward. No dissent.
Fresh headline in one of the papers today, a second raucous party, says the Times, dancing and drinking wine late into the night at another event in December. Any knowledge of that one, Secretary of State?
No. But I do know that Simon Case is not just looking at a particular date. He's free to look at whatever dates he wants to consider.
And lastly, some TV producers thought it was jolly fun to empty chair you yesterday. That is where to explain to my listeners, they turned to the Secretary of State. I think that's probably had its day, but what do I know? You're the Secretary of State. How do you react to that?
Look, I understand and I've been very honest about this. I didn't come up for interviews, whether it's with you or others, yesterday because I saw that video. It upset me, and I wanted to give the Prime Minister and his team the opportunity, the space to respond to that. And I am pleased in the way that they have responded. But I wanted for there to be a proper response to that, and let's see where that investigation goes.
Grateful for your time. Thank you. 2 minutes after 8 here on LBC. Secretary of State Sajid Javid appearing before the headlines with Simon Conway.
On your radio, on Global Player, and
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom, the Health Secretary has told LBC he's received assurances there was no party in Downing Street last December.